This x-ray might help you make up your mind if you're debating whether or not to get the flu shot. When people hear influenza, they often think runny nose, mild cough. They get it mixed up with the common cold, but that's not actually accurate. The flu is a virus that knocks you out flat. Typically, it'll give you debilitating symptoms of fevers, chills, muscle aches, headaches, sore throat, and a cough. And these symptoms will typically last for 5 to 10 days on the mild end. But every year, I treat patients who develop severe symptoms that develop into pneumonia or acute respiratory distress syndrome, or ARDS. And that's an inflammatory reaction of your lungs that fills your lungs up with fluid and makes it hard to exchange oxygen. This is the x-ray of a 40-year-old that I took care of last year who developed severe ARDS and required intubation and a 2-week ICU admission and almost died because of the flu. And if you ask any ER doctor, they're going to tell you very similar cases that they have seen every year during the flu season as well. People who are older or have chronic medical conditions are going to be at higher risk of developing severe symptoms. And globally, influenza kills roughly 500,000 people every single year. So the flu isn't something to simply just shrug off. The good thing is that we have a solid way to protect ourselves, and that's the flu shot. Flu shots contain inactivated pieces of the virus. So you can think of it like you capture a bug, you rip off the harmless arm of the bug or the antigen, and you replicate that into a vaccine that you can inject into our arm so that our immune systems can learn to recognize the bug so that if the virus actually does invade our system, it can attack it immediately. Influenza viruses change a little bit with time and as they travel around the world, and that's why we need to get vaccinated every year because we have to target different strains. Because the weather and the seasons are the opposite between the northern and southern hemispheres, that also means that the flu seasons occur at different times. So we use the data from the southern hemisphere's recent flu season to design the northern hemisphere's flu vaccine. And based on that data, getting the flu shot this year will reduce your risk of either getting influenza or flu-related hospitalization by about 50%. Vaccination also reduces person-to-person spread, and that means that you're going to be protecting everyone around you. There's a lot of misinformation out there on the side effects of vaccines, but statistically, serious reactions like Guillain-Barré syndrome are extremely rare, somewhere in the range of 1 to 2 cases per million doses. And mild side effects like sore arm or feeling fatigued for a day are common, but they're usually very short-lived, and the overall safety profile is actually very strong. For me, it's a no-brainer. The benefits clearly outweigh the risks, and it doesn't leave me wondering if I should get the flu shot. I'm Dr. Jeff, a board-certified ER doctor, and I teach you about medicine through my lens. Follow me to learn more.